Good morning. I am Anita Palma, BS in 3D, and I will be reporting urology. What is urology? Urology is a part of healthcare that deals with male and female urinary tract diseases such as kidney, ureter, bladder, and urethra. Urologic surgery focus on the urinary tracts of males and females and on the reproductive system of the males. Urologic surgery is the integration of surgical activities for the pelvis, the colon, urogenital, and gynecological organs, primarily for the treatment of obstruction, dysfunction, malignancies, and other inflammatory diseases. Urology comes from the Greek word uron, means urine, and logia means study of. Urosurgery, also known as genitourinary surgery, the modern specialty, derives directly from the medieval lithologists who were internal healers specializing in the surgical removal of bladder stones. In 1588, the Spanish surgeon Francisco Diaz wrote the first treatise on disease of the bladder, kidneys, and urethra. He is generally regarded as the founder of modern urology. Most modern urologic procedures developed during the 19th century. At that time, flexible catheters were developed for examining and draining the bladder. In 1877, the German urologist Max Schmitz developed the cystoscope. Cystoscope is a device po siya na ini-insert sa ureter ng male or ng female para makita yung nasa loob. Different types of urology surgery. Vasectomy. Vasectomy is a surgical procedure used for permanent male birth control, cutting of supply of sperm of the semen by cutting and sealing the vas deferens. Vasectomy reversal is a surgical procedure using microsurgical techniques are used to repair the vas deferens. Cystoscopy is a urology procedure that allows the urologist to examine the lining of the bladder and the urethra. An instrument called cystoscope is inserted into the urethra and guided into the bladder. Transurethral resection of the prostate, a minimally invasive procedure that uses a special instrument called a resectoscope to trim and seal prostate tissue when the prostate is enlarged and causing difficulty in urination. Lithotripsy is a urology procedure that uses shock waves or laser to break down stones in the kidney bladder or ureter. The laser shock waves break up large stones so that they can pass through the urinary system. Vasectomy procedure is a male birth control. Ang ginagawa sa vasectomy procedure is kinakat yung vas deferens kung saan dumadaan yung sperms. Kinakat yun para wala nang madaanan yung sperms. Nang sa ganun, di makakabuo yung lalaki. Vasectomy, preoperative nursing management. Sign a firm consent para alam ng patient yung mga benefit, risk, and ng procedures. Don't take aspirin, ibuprofen, or naproxen for 2 weeks before the surgery kasi pwede siyang mag-cause ng bleeding sa surgery. Tell your provider if you have had any scrotal surgery in the past. Arrange an adult family member or friend to give you a ride after surgery. Shower and clean your scrotum the day of surgery. Bring jock strap or pair of snug cotton brief to the provider, office, or hospital. Para after the surgery is may susuotin ka at pwede mo yung gamit at pwede magamit as a supporter dun sa scrotum mo once na matapos yung surgery. Follow any direction you are given for not eating or drinking before the surgery para maiwasan ang obstruction. Post-operative nursing management. Stay off your feet as much as possible for the first 2 weeks. Wear an athletic supporter or snug cotton briefs for support. Reduce swelling by using an ice pack. Take medicines with an acetaminophen or to ease any mild pain. Acetaminophen is a pain reliever medication. Wait 48 hours before bathing. Don't do heavy lifting or exercise for 7 days. Ask your healthcare provider how long to wait before having sex again. Vasectomy reversal. Vasectomy reversal is a procedure using microsurgical techniques are used to repair vas deferens. Vasectomy reversal ay kabaliktaran ng vasectomy surgery. Preoperative nursing management. You may know what steps you need to take before surgery. Your doctor probably will ask you to stop taking certain medication including blood thinning medication and pain relievers such as aspirin or ibuprofen because they can increase your risk for bleeding. Clothing and personal items. Bring tight lifting undergarments such as athletic supporters to wear after surgery. This will support your scrotum and hold bandage in place. Other precautions. Arrange for someone to drive you home after surgery. Surgery is generally take about 2 to 4 hours or longer. You may need additional time to recover if the procedure is done with general anesthesia. Ask your doctor when you can expect to go home after surgery. Vasectomy reversal preoperative nursing management. Take your history and perform physical exam. Your doctor will want you to make sure that you don't have any concerns that could complicate surgery. Para malaman na rin if fit kang i-undergo yung procedure. Check to see whether you can produce healthy sperm. Most men having fathered a child before is proof enough. After a vasectomy, your testicle continues to produce sperm, but the amount of sperm that you produce may have decreased over time. Age, diet, exercise, smoking, and other things can change how much healthy sperm you can produce. To be sure, your doctor may want to perform tests before surgery. Confirm that your partner is capable of having a child. Your doctor will want to see whether your partner has any fertility problems or dysfunction, especially if your partner never had a child or is in the age 40. He may require a gynecological exam and other tests. For several weeks, wear athletic supporter except when showering. For the first 2 days after surgery, avoid anything that might get the surgery site wet, such as bathing or swimming. Limit activities that may pull on the testicle scrotum, such as jogging activities, biking, heavy lifting for at least 6 to 8 weeks after the surgery. If you have a desk job, you'll probably be able to return to your work few days after surgery. Don't have sexual intercourse or ejaculate until your doctor says it's okay. Most men need to refrain from ejaculating for 2 to 3 weeks after surgery. Cystoscopy. Cystoscopy is a urology procedure that allows a urologist to examine the lining of the bladder and the urethra. An instrument called cystoscope is inserted into the urethra and guided to bladder. Preoperative nursing management assess patient understanding to the procedures and answer any queries. Obtain informed consent, withhold blood thinning medication, provide instructions for fasting and non-fasting preparation, establish an IV line, prepare the patient, administer sedation and other medication as ordered. Para maiwasan yung mga complication, kailangan po natin tong sundin na preoperative nursing management. Post-operative nursing management. Monitor and record vital signs. Assess the patient's ability to void for at least 24 hours after the procedure. Monitor also the intake and output of the patient. Observe the color of the urine. Encourage increased fluid intake as indicated. Encourage deep breathing. Provide warm cyst bath and administered mild analgesic as ordered to ease the pain. Watch out for signs of serious complications such as sepsis, bladder perforation, or hematuria. Transurethral prostate. Pre-op nursing management. Transurethral resection of the prostate is a urological operation. It is used to treat benign prostatic hyperplasia. As the name indicates, it is performed by visualizing the prostate through the urethra and removing tissue by electrocautery or sharp dissection. Surgical procedure, endoscopy, positioning, lithotomy. Anesthetic choice, spinal or general. Depends sa pagustuhan ng patient. Preoperative nursing management. Preoperative medical assessment such as history of recent illness, past medical history, or past surgical history, allergies, medication, and physical examinations. The patient should be starved for at least 6 hours before the surgery and make sure that he is kept hydrated through adequate IV infusion. An ECG done in last 2 weeks. Blood results and blood type from past 3 days. Post-operative nursing management. Determine his consciousness level. Ask if he is pain or feeling nauseous as there are expected after surgery. Yung pain and feeling nauseous is natural na yun after kang mag-undergo ng ganitong klaseng surgery. Assess his airway and determine breathing patterns. Vital signs, we need to monitor them. Circulation in his hands and feet, kailangan din natin yun i-monitor. Check the penis if bleeding around the catheter. Take note of the urine, volume, and color. Kasi, if halimbawa masyadong mababa yung output ni patient, kailangan natin siyang ipainom ng maraming tubig or dagdagan yung IV naka-infuse sa kanya para maging hydrated siya. Then, dun naman sa urine color, too dark urine, pwedeng may infection or may iba pang abnormal sa kanyang urinary system. Lithotripsy. Yung lithotripsy po, procedure po siya under the urology kung saan gumagamit ng shockwaves para ma-breakdown yung mga malalaking stone sa kidney at ma-excrete yun through urine. Pre-operative nursing management, EKG or electrocardiogram, CBC, complete blood count, PT or PTT, blood coagulation profile, comprehensive metabolic panel, blood chemistry profile, urinalysis. Sa pamamagitan ng mga test na to, malalaman mo kung may iba pang abnormalities or dysfunction sa kanyang urinary system or urinary tract. Post-operative nursing management. Be sure you have someone to take you home. Anesthesia and pain medicine will make you unsafe for you to drive or get home on your own. Understand exactly what procedure is planned along with the risk, benefit, and other options. Kaya kailangan before the procedure, kailangan din natin kunin yung consent ng patient. Or kung hindi naman kaya ng patient na mag-sign sa informed consent, pwede nating makuha yung consent na yun sa guardian or dun sa nagbabantay sa kanya. If you take aspirin or some other blood thinners, ask your doctor if you should stop taking before procedure. Make sure that you understand exactly what your doctor wants you to do. These medicines increase the risk for bleeding. Gaya ng ibang surgery procedure, any medications, kailangan mo yung stop. Then, blood thinning medication pwedeng cause bleeding when surgery begins. Tell your doctor all medicines and natural health products you take. Some may increase the risk for problems during the procedure. Your doctor will tell you if you should stop taking any of them before the procedure and how soon to do it. Make sure your doctor and other hospital have a copy of your advanced care plan. If you don't have one, you may want to prepare one. It let others know your health care wishes. It's a good thing to have before any type of surgery or procedure. In the initial period, monitor vital signs frequently. The kidney is highly vascular, therefore hemorrhage and resulting shock are potential complications of the lithotripsy. Bleeding may be internal or retroperitoneal and difficult to detect. Complication na pwedeng makuha sa lithotripsy is bleeding sa loob ng kidney or kung hindi sa kidney is sa retroperitoneal. Pwedeng magkaroon din ng bleeding as a complication after the surgery. Then, monitor the vital signs closely para malaman natin if stable yung ating patient. Monitor amount of color and clarity of urine output. Urine is often bright and red initially, but bleeding should diminish within 48 to 72 hours. Cloudy urine may indicate the presence of an infection. Maintain placement and patterns of urinary catheters. Anchor urethral catheters or nephrostomy tubes securely. Irrigate gently if ordered. A kind of blood catheter may result in hydronephrosis and kidney damage, decreased urinary output, and flank pain are possible symptoms of obstructed urine flow. Excessive force in irrigation may cause bleeding. Prepare for discharge by taking care of dwelling, catheter urine collection device, and the incision site if present. Teach signs and symptoms of report urine leakage from incision for more than 4 days. Symptoms of infection, pain, bright hematuria. Many clients are discharged with dressings and catheter in place. The client and family need necessary information to provide health care. If ever gusto ng client na ma-discharge sa ospital, kailangan mong ituro sa kanya kung paano niya aalagaan yung kanyang sarili and paano niya aalagaan yung and inform also the family member kung paano nila matutulungan alagaan yung patient para sa pagpapagaling nito. Teach measures to reduce the risk of further lithiasis. Many clients have repeated episodes of lithiasis and renal colic. Prevention of stone formation is important to preserve renal function. Thank you.